Coffee is a beloved morning ritual for countless people worldwide, delivering that much-needed jolt of energy to kickstart the day. But here's the catch. While your daily cup of coffee may seem completely harmless, it can actually interact with various medications, sometimes in ways that reduce their effectiveness or even increase the risk of unpleasant side effects. This is a crucial detail that often flies under the radar, yet it can significantly impact your health. Caffeine, the key stimulant in coffee, influences the body far beyond just boosting alertness. While tea also contains caffeine, it usually has lower amounts and tends to affect people differently. But when caffeine meets certain medications, the consequences can be surprising and sometimes serious. Let's break down some common types of medicines you should be cautious about combining with coffee, and why. 1. Cold and flu treatments. Coffee's caffeine is a stimulant that speeds up your central nervous system. Many cold and flu medications, including those with pseudoephedrine, like Sudafed, also act as stimulants. Mixing the two can amplify these effects, potentially causing symptoms such as jitteriness, restlessness, headaches, an increased heart rate, and difficulty sleeping. Adding to the risk, many cold remedies already contain caffeine, which further intensifies these issues. In fact, some research shows that combining caffeine with pseudoephedrine might increase blood sugar levels and body temperature, which is especially concerning for people managing diabetes. Beyond cold medicines, this stimulant interaction is also relevant for those on ADHD drugs, such as amphetamines, or asthma treatments like theophylline, which is chemically similar to caffeine. In these cases, coffee could heighten side effects like rapid heartbeat and insomnia. 2. Thyroid medications. If you're taking levothyroxine, the standard therapy for hypothyroidism and underactive thyroid, timing is everything. Drinking coffee too soon after your dose can reduce absorption of the medication by up to half. This happens because caffeine speeds up gut motility, the rate at which food moves through your digestive system, leaving less time for the drug to be absorbed. Additionally, caffeine may bind to the medication in your stomach, making it harder for your body to take it in properly. Levothyroxine's effectiveness depends on it entering your bloodstream. So reduced absorption can lead to a return of hypothyroid symptoms like fatigue, weight gain, and constipation, even if you're otherwise following your treatment plan correctly. This interaction is more common with tablet forms of the drug. Liquid versions seem less affected. Similar timing concerns apply to bisphosphonates, a group of drugs used to treat osteoporosis, such as alendronate and risodronate. These also need to be taken on an empty stomach and require you to wait 30 to 60 minutes before eating or drinking anything, including coffee. 3. Antidepressants and antipsychotics. The way caffeine interacts with mental health medications is quite complex and often misunderstood. Selective serotonin reuptake inhibitors, SSRIs, like sertraline and citalopram, are widely prescribed antidepressants. Lab studies suggest that caffeine can bind to these drugs in the stomach, potentially reducing their absorption and making them less effective. Older antidepressants, known as tricyclic antidepressants, TCAs, such as amitriptyline and imipramine, are processed by the same liver enzyme, CYP1A2, that metabolizes caffeine. When caffeine and TCAs compete for this enzyme, it may slow the breakdown of the medication, increasing the chances of side effects, or delay caffeine clearance, so you might feel jittery or wired for longer. Clozapine, an antipsychotic medication also metabolized by CYP1A2, shows a notable interaction. Studies have found that drinking even 2 to 3 cups of coffee daily can almost double clozapine levels in the blood. This spike may lead to increased risks like drowsiness, confusion, or more serious complications. 4. Pain relievers. Some over-the-counter painkillers, particularly those containing aspirin or paracetamol, often include added caffeine because it can help the medication work faster. Coffee can enhance this effect by speeding up stomach emptying and increasing stomach acidity, which improves absorption for some medicines. While this might sound beneficial, the downside is that combining coffee with caffeine-containing painkillers could elevate the risk of side effects like stomach irritation or even bleeding, especially if you consume a lot of caffeine from other sources. Although serious problems are rare, it's wise to exercise caution and be mindful of your total caffeine intake. 5. Heart medications. Caffeine tends to temporarily raise blood pressure and heart rate for about 3 to 4 hours after consumption. For individuals taking medication for high blood pressure or treatments aimed at regulating irregular heartbeats, these effects could undermine the goals of their therapy. This doesn't mean you must eliminate coffee entirely if you have heart-related conditions, but closely monitoring your symptoms and discussing your caffeine consumption with your doctor is essential. You may find that reducing your intake or choosing decaffeinated options is a safer route. So what's the bottom line? Coffee isn't just a comforting drink. It's a potent chemical that can shape how your body handles medication. To ensure your morning fix doesn't compromise your treatment, take levothyroxine or bisphosphonates with plain water on an empty stomach and wait at least 30 to 60 minutes before enjoying coffee or breakfast. Be cautious with cold and flu medications, asthma treatments, and ADHD drugs, as caffeine may intensify side effects. If you're prescribed antidepressants, antipsychotics, or heart medications, have an open conversation with your healthcare provider about your caffeine habits. Consider cutting back or switching to decaf if you notice side effects like restlessness, difficulty sleeping, or heart palpitations. Remember, caffeine affects everyone differently. While some people handle 3 cups with no issues, others might experience problems from just 1. It's important to listen to your body and consult a pharmacist or doctor if something feels off. And here's a question worth pondering. Should healthcare providers routinely discuss caffeine consumption when prescribing medications? Could increased awareness about these interactions improve patient outcomes? Share your thoughts and experiences. Do you think coffee's role in medication effectiveness is underestimated? If in doubt about whether your coffee and medication form a safe combo, don't hesitate to ask a healthcare professional. A brief chat could prevent weeks of unintended side effects or poor treatment results and allow you to enjoy your coffee worry-free. Deepa Kamdar is a senior lecturer in pharmacy practice at Kingston University. This article is republished from the conversation under a Creative Commons license.